Hey everybody, today we're going to be talking about the pain-sensitive areas of the head. This video mainly comprises of 4 topics, namely headache, the anatomy of the head, pain-sensitive areas, as well as the mechanisms of cranial pain. So let's start out the discussion with headache.
Headache is a very common condition that causes discomfort in the head, scalp, or neck. Headache is all aches and pains located in the head, but in medical term, headache is a discomfort in the region of the cranial vault. Headache is classified as either primary or secondary. Primary headaches and the features are the disorders itself. In order of the decreasing incidence, the most common is tension type, followed by migraine, idiopathic stabbing, exertional, and cluster, while secondary headaches caused by exogenous disorders like systemic infection, head injury, vascular disorders, subarachnoid hemorrhage, and brain tumor.
The anatomy of the head.
The head contains many important structures compressed into a relatively small area. The skull, with the enclosed brain and meninges, forms most of the head. The skull is composed of several separate bones united at immobile joints called sutures. The bones of the skull are organized into a cranial skeleton and a facial skeleton. The cranium consists of the frontal bone, parietal bones, occipital bone, temporal bones, sphenoid bone, and the ethmoid bone. And the facial skeleton consists of the maxillae, nasal bones, lacrimal bones, the vomer, palatine bones, inferior conchae, and the mandible. Within the viscerocranium are air-filled bone cavities covered with thick, vascular secretory mucosa known as the paranasal sinuses. They include the frontal, ethmoid, sphenoid, and the maxillary sinuses. Externally, the head, excluding the face, is covered by the scalp. It consists of 5 layers, namely the skin, dense connective tissue, aponeurosis, loose areolar tissue, and the pericranium. Internally, the cranium is lined by membranous coverings called the cranial meninges. They are composed of 3 membranous connective tissue layers named the dura mater, arachnoid mater, and the pia mater. The dura mater is a tough, thick, fibrous membrane covering and in several areas divides into a periosteal layer and a meningeal layer. The arachnoid mater is a delicate, non-vascular connective tissue membrane between the dura mater and the pia mater. It intimately adheres to the deep side of the dura and is separated from the pia mater by the subarachnoid space, which is filled with cerebrospinal fluid. The pia mater is a vascular membrane that closely invests the brain, covering the gyri and descending into the deepest sulci. 12 pairs of cranial nerves which arise from the brain pass through the foramina and fissures in the skull, and all are distributed to structures in the head and neck except the 10th, which also supplies structures in the chest and abdomen. The olfactory, optic, and the vestibular cochlear nerves are purely sensory, while the oculomotor, trochlear, abducens, accessory, and hypoglossal nerves are purely motor in function. The rest of the cranial nerves have mixed functions.
Pain-sensitive areas.
Pain-sensitive areas is divided into intracranial or extracranial. Intracranial sensitive areas include large arteries near circle of Willis, large venous sinuses, dural arteries, parts of dura at the base of the brain, middle meningeal and superficial temporal arteries, proximal portions of the cerebral arteries, cranial nerves 5, 7, 9, 10, and cervical nerves 1, 2, 3. While the parenchyma of the brain, pia mater, arachnoid mater, parts of the dura mater, ependyma, and choroid plexus are intracranial insensitive areas. Now we go to the extracranial sensitive areas, which include the skin, muscle, fascia, blood vessel, mucosa of sinuses, dental structures, ear, eye, nasal cavities, and paranasal sinuses. And except for the periosteum, skull is an extracranial insensitive area.
Mechanisms of cranial pain.
First is vascular. It occurs when there is dilatation of intracranial and extracranial arteries, examples of which are malignant hypertension, exertional headaches, which occurs during sexual activity and weightlifting. But these headaches are not that serious compared to the other causes of vascular headaches. Next is aneurysmal subarachnoid hemorrhage, which is very intense and sudden. It is associated with vomiting and neck stiffness. It is also identical to thunderclap headache. Another example is cerebrovascular disease, such as giant cell arteritis, which affects the extracranial, temporal, and occipital arteries. It is severe and persistent headache and localized in the scalp. Next is the occlusion or dissection of vertebral artery, which causes pain in the upper neck or post-auricular area. Then lastly, the basilar artery thrombosis.
A myogenic headache, also called a muscle contraction headache, is produced by contraction of the muscles in the head and neck. This headache is extremely variable in frequency, intensity, and duration. Myogenic headaches often occur as a reaction to various conditions such as stress or as a somatic manifestation in chemically depressed patients. It can also occur in patients with cervical arthritis or following migraine attacks. The pain in myogenic headaches is constant and can be located in any area of the head and neck, but is most often localized to the occipital area. Pain may also be described to be distributed in a hat band pattern.
So next we have traction. So this is mainly due to the increase in intracranial pressure resulting to traction of pain-sensitive areas. So there are a variety of organic diseases of the head that can cause traction headache. Traction headaches are caused by the distortion of intracranial pain-sensitive structures. This type of headache may be caused by intracranial bleeding or tumors, brain infections, obstruction of flow of cerebrospinal fluid, and low pressure of the fluid due to leakage after lumbar puncture. So with this, it is a steady occipitonuchal and frontal type of pain. It happens within a few minutes after arising from recumbent position, and it is relieved by lying down. Other examples down here below, we have here your subdural hematoma. So these headaches are aggravated by lying down or lying in one side, which occurs with acute or chronic subdural hematomas. They are dull and unilateral, and they are worst early in the morning. Next, we have intracranial tumors. So these type of headache as a result of intracranial tumors often become more intense with Valsalva maneuvers such as coughing, urinating, or straining at stool. Such headaches are often more severe in the morning on awakening and decrease during the day as intracranial pressure decreases with the maintenance of upright posture. Next, we have giant cell arteritis or your temporal arteritis. So the headache in temporal arteritis is throbbing, intense, and persistent, and often it is associated with a burning component. So patients may note mastication. There is pain during mastication. Also, ocular complaints may be present within the symptoms.